Hi, Dr. Lindsey here. In this video, I'm going to show you examples of when we've done upper eyelid surgery on older male hair transplant patients. So, I just turned 60 a few months ago, and so I now consider myself an old guy. But frankly, anybody over 50, things that come along with aging are starting to happen, meaning your eyebrows come down, you get extra skin on your upper eyelids, you get some jowling, it gets worse all the way down. And so, over the past 29 years, I've done thousands of facelifts on women, occasionally man, and I've done thousands of hair transplants on men, occasionally women. The crossover is upper eyelids. And so what typically happens is when somebody comes in my age group, to look at their 1 year or 15-month pictures on their hair transplant, we'll be looking at the pictures, and because I just took their post-op pictures, I haven't cropped their face off the images. And we'll be looking at the hair, and by and large people are saying, oh yeah, the hair looks good, but oh my gosh, my eyes look so tired. And people just haven't appreciated that until they see a picture. And so what happens is, then the patient says, what can I do about it? And you really have three choices. You can raise the eyebrow surgically. I rarely do that on men because you go through a temporary period where you do look surprised. It's often too much for men, and it can make a man look effeminate. The second choice is to take off some upper eyelid skin, and there's usually a little bit of fat towards the center of the upper eyelids. And I've done lots of those on men. In fact, I need a set, but I just am having trouble finding somebody who's conservative, because on a man, if you take too much off, you end up looking effeminate. And the third choice is to do both of those. I do that about a third of the time on women, where we do the brows and then do the eyelids to get enough change that they want. So what's involved is, in the office under local anesthesia, we just numb up the eyelids and take off a little extra skin and a little bit of fat towards the center. Sew it up. It really shouldn't hurt at all. There's 2 numbing shots that feel like a little pinch. And then we put some stitches in. A couple of the stitches come out on the 2nd day, and the rest of the stitches come out on the 5th or 6th day. And at a week, you generally look, if you don't have much bruising, which most people don't, you look good at a week, and you look better at a month when things kind of settle down. So let me take you through 3 examples, and I think 2 of these guys are in other videos about their hair. So here's example number 1, and this is a guy that drums in one of my bands, and he'd had a hair transplant elsewhere that was less than totally successful. And so we did his hair transplant, and he did great. And then, like a lot of guys, he had a little hair greed. So about a year or 2 out from his first hair transplant, he wanted to add a little hair here, put a little hair in the back, and then 7 or 8 days later, he wanted to do his upper eyelids. And so in this before picture, you'll note that looks like he's had a hair transplant recently, and it was. So we added a few hairs to the hairline. And he's got hooding of his upper eyelids, and then here he is at a week, and it's a little swollen, a little bruised, and then here he is at 4 months. You'll notice his hair is growing in better, and then here he is down the road a ways, and he just looks unremarkable. He does not look effeminate, and just looks more well rested. That's usually what people come back and say. I look more well rested. People say I don't look tired. Here's example 2. This is this big semi-pro wrestler, submission hold expert guy that we repaired his hair transplant a while back. And then we did his upper eyelids. He's the last guy in the world you want to make look effeminate. So he had a lot of hooding before, and then here he is as a final result. And again, he doesn't look like a different person. He just doesn't look so doggone tired like he looked before. His hair is also grown in nicely. And then example 3 is a good friend of mine, and we did this fellow's eyelids 7 or 8 years ago. Here he is before, again with very little hair, and here he is in a month, and then here he is about 2 years after his hair transplant. Now that's 7 years out from his eyelids. And he just looks unremarkable. He's got a great head of hair, doesn't look tired around his eyes. And I think he's 74. What a big change with minimal risk and minimal downtime. It's just something to think about for guys in my age bracket. If we can help you, give us a call. Thank you.